In this video, we talk about the financial healthcare risks that many retirees just don't understand. Coming up next on Holy Schmidt.
Holy Schmidt!
There was a report released last month from the Center for Retirement Research called Do Older Adults Understand Healthcare Risks and Do Advisors Help? That information is pretty well discussed on articles, books, YouTube videos, and other media. So most people understand, at least at some level, those type of risks. But then it gets into the things that really aren't disclosed, or at least not disclosed widely for people. And this is where we're going to go. The first are the two risks of healthcare costs. There's first and foremost the individual risk. That risk is that you as a person are going to require a lot more health care than the person down the street from you, simply because no one knows what the future holds. Most people don't think about this, at least not deeply, because frankly, they haven't been there yet. If you haven't been faced with a condition, a health condition that costs a lot of money and takes away a lot of your time and energy, well, it's something that you read about, but it's not the same thing. But the other is the impact of inflation on things like cost of Medicare, or on the size of the copay, or on other issues, other things that just aren't covered by your insurance. Medical costs, without even discussing long-term care yet, eat up about 1/3 of the average retiree's Social Security payment and about 1/5 of their overall expenses in retirement. So for every $1,000 someone brings in retirement, they spend $200 on medical costs. And for most people, it's the cost of Medicare, Medigap, Medicare Advantage, and copays and deductibles. And a very important part, Medicare Part B, tends to go up faster than inflation. It's been that way for decades. Now, what this means in reality is that a retiree might be reasonably well insured for their medical costs in any particular year, but over a period of time, their costs can escalate pretty significantly. On this channel, we look for partners that will serve you, our viewers, well. In fact, to date, we only have 3. One that we're really excited about, it took us months to find, is Chapter Medicare Advisors. Chapter has access to over 24,000 plans, and they're open 6 days a week. So if you'd like to talk to somebody about Medicare, give them a call to see if they can help you. They're friendly and always 100% free. You can call them at the number above, or you can scan the QR code to take their online quiz that helps determine your needs. When you do call, make sure that you tell them that Jeff Schmidt sent you. Now back to the video. And then there's the other side, the one that nobody really wants to think about, and that's the cost of long-term care. Now here's the facts. According to this report, and I've read this same data elsewhere, 20% of retirees never have any long-term care claims. 20%. That means 80% do have long-term care claims. Those costs vary by duration, meaning the amount of time that they're in a long-term care facility, and by intensity, meaning the actual cost of the treatment within that facility. But 40% of retirees are in a long-term care facility, or have long-term care anyway, for at least a year, if not longer. And unlike medical costs, long-term care costs are not well insured. 3% of adults have long-term care insurance, and 15% of retirees have long-term care insurance. So what are the costs for long-term care? Well, there are basically 3 different types of long-term care. The first is a private room in a nursing home. That's on average about $116,800 per year. The second is skilled nursing services at home. That's $75,500 per year. And the third is long-term care in an assisted living facility, and that's $64,200 per year. But here's the really scary part about this. Most people actually miss the mark when it comes to their expectation of the costs related to this issue. Let me explain. Well, there was a survey done with 508 participants aged 48 to 78 with $100,000 or more of investable assets. That's a very specific group, but it probably represents a lot of people who are watching this video. And that group said, on average, they thought 1 out of 3 people would require expensive medical care or long-term care in retirement. But the reality is it's double that. It's 2/3 of the population. And then the survey goes into who pays for long-term care. 45% of the respondents thought that Medicare would cover the cost of long-term care. Of course, it doesn't. So what happens if someone who is okay in terms of their financing so they don't really qualify for Medicaid, does in fact need long-term care. Well, that falls on either the spouse or the children of the person who needs long-term care most of the time. So what this information really tells me is that a lot of people don't think about this, number one, because it's not really clear like a lot of information that's out there. A lot of information is just regurgitation of that information from one website to another, from one YouTuber to another, from one book writer to another. But this information is a little bit harder to find and frankly has a lot more impact on your life if you don't understand the risks. I'll put a link to this report in the description below so that you have it, but you only really need to read the front half because the back half really talks about how financial advisors should advise their clients on this information. If you like this video, check out that video, Trump's plan for Medicare drug prices. This is Jeff Schmidt, and I will see you in that video right there.